Welcome to the deep dive. Today, we're going to get into something pretty fascinating. AI meets healthcare. Specifically, this company, Tempus AI. You hear their name quite a bit lately.
Absolutely. It's a really critical time for how technology is changing medicine and looking at companies like Tempus AI, how they're actually using AI, not just talking about it. Well, it gives you a real window into where patient care might be heading.
Exactly. And we're basing this deep dive on an article, Tempus AI, the AI-driven healthcare disruptor investors should watch. So our goal today really is to understand what Tempus AI is all about. Their tech, how they operate, their financials, and the kind of impact they might actually have.
Basically give you the shortcut to being up to speed on them.
Yeah, exactly. You're fast track.
Yeah.
So let's dive right in. What's really at the core of Tempus AI? What makes them tick?
Well, at its heart, Tempus AI is all about using AI, artificial intelligence, to make sense of just enormous amounts of biological and medical data. A really big piece of this is their work in next-generation sequencing, NGS.
NGS, right.
Think of it like a super fast, super detailed way to read someone's genetic code. Tempus AI does a lot of this, looking at the whole genome or just specific bits. Their XT platform, for instance, it includes an FDA-approved panel, looks at 648 genes.
Okay.
And it's designed to find both somatic mutations, the ones you get during your life, and germline mutations, the ones you inherit.
So it's like getting this incredibly detailed genetic map. Now, the article mentioned they do more than just DNA, something about RNA.
Exactly, yeah. That's a
Yeah.
key part. They combine DNA and RNA sequencing. RNA, it carries the instructions from the DNA to make proteins. So looking at RNA shows which genes are actually switched on doing things.
Oh, okay. Active genes.
Right. And the research shows by looking at both DNA and RNA, Tempus AI finds about 15.3% more what they call actionable variants.
Actionable variants, meaning
Meaning genetic changes that doctors actually know how to target, maybe with a specific drug, or it tells them something important about managing the patient's disease. It just gives a much more complete picture for, planning treatment.
that makes sense. It's not just the blueprint. It's seeing what part of the blueprint is actually being used right now. Okay, so they generate all this detailed genetic data, but that's only part of it, isn't it? The article kept mentioning this huge AI database.
Oh, yeah, absolutely. The database is, well, it's massive, over 100 petabytes.
Wow.
Which contains something like 6 million de-identified research records. And it's not just the genetic stuff, it's clinical notes, medical images, and really importantly, how patients actually responded to different treatments.
So a huge pool of real-world experience.
Exactly. And the AI models they've built, they constantly mine this data, looking for patterns, correlations, things a human might just miss. This lets them predict how, say, a new patient might respond to a drug, helping doctors refine treatment choices.
It sounds like this giant digital library of medical cases, with AI acting as a super smart researcher, finding hidden connections. And it's not just locked away, right? Researchers can actually use this.
Correct. They have a platform called Tempus Lens. It gives researchers the tools to analyze all this data. They can use it to look for potential new drug targets, develop more precise, personalized medicine strategies. It's all about unlocking the knowledge hidden in there.
Okay, so sophisticated sequencing, massive data, analytical tools. How does this all actually, help patients in terms of diagnostics, getting the right treatment?
Yeah, this is where their machine learning really shines. They're using AI for diagnostics in some really practical ways. Tempus One is a good example. It's an AI clinical assistant.
Okay.
It can process unstructured data in real time, things like doctor's notes, lab reports, all that tech stuff that isn't in neat database fields. The AI pulls out key information to help match patients with clinical trials much faster or suggest treatments based on that patient's specific profile.
Finding the right trial faster, that's huge for patients. And it sounds like AI is also involved earlier, like in finding new drugs altogether.
Precisely. Their work with GSK, for example, they're using AI to analyze their data to help find new targets for drugs. By spotting specific genetic markers or patient traits linked to a disease, they can potentially speed up the whole drug discovery process.
So they're really touching the whole spectrum, from basic research right up to helping doctors make decisions. Now, to make this work, they must be working closely with hospitals and doctors. The article mentioned a big partnership network.
Oh, definitely. Their network is a major strength. They work with over 2,500 healthcare institutions. That includes something like 65% of U.S. academic medical centers and over half of the oncologists in the U.S.
Wow, 65% of academic centers.
Yeah.
That's really deep integration. Can you give some examples, like who are they working with and what are they doing?
Sure. So with Northwestern Medicine, it's about AI in cardiology. With Pfizer, it's focused on cancer drug development. Takeda, they're working together to expand Takeda's cancer treatments. And with BioNTech, it's a collaboration digging deep into oncology data.
So these aren't just like superficial agreements. They're strategic collaborations focused on specific medical areas.
Exactly. And each partnership doesn't just extend their reach, it also feeds more data, more diverse data back into their system.
Right, making the AI smarter.
Precisely. It creates this kind of positive feedback loop, constantly improving their AI and strengthening their position in precision medicine.
Okay, the tech and partnership sound strong, but how does Tempus AI actually, make money? What's the business model behind it all?
Right. So they basically have two main ways they generate revenue. First is genomics. It's doing the diagnostic tests we talked about. In 2024, that brought in about $451.7 million. Showed pretty solid growth, too, 24.4% year over year.
Okay, nearly $500 million from testing. And the second stream, that's the data side.
Correct. That's their data and services division. This is where they license access to their database and their AI tools, mostly to pharmaceutical companies for research. That part brought in $241.6 million in 2024.
And the growth there.
Even faster, actually. 43.2% year-over-year growth.
Wow, okay. That really shows how valuable pharma companies find that data, doesn't it? What about the long run? Is this model built to last, to scale?
It seems designed for scalability, yeah. You've got repeat testing for patients over time, plus these long-term data licensing deals. That builds recurring revenue. And they also made a big move in late 2024, acquiring Ambry Genetics for $600 million.
Ambry Genetics, right.
Yeah, that significantly expanded their genomic testing options, making them, even more competitive.
So building recurring revenue and making acquisitions to grow. Sounds like a solid strategy. The article mentioned a competitive moat. What does that mean for Tempus?
A moat, yeah. It's basically the advantages a company has that make it hard for competitors to steal their business. For Tempus AI, it really comes down to that huge, growing data network combined with their specialized AI.
The data and the brains to analyze it.
Exactly. The sheer amount and richness of their clinical and genomic data, plus the AI they've built specifically for it, that's a pretty high wall for anyone else trying to build the same thing from scratch.
The article compared them to some big names, right? Google, IBM, Illumina. How did Tempus stack up?
Yeah, it was an interesting comparison. The key things that made Tempus AI stand out in that analysis were things like having their own AI-powered genomic database, those deep integrations directly into hospital systems.
Right, the partnerships we talked about.
Exactly. Also, having proprietary AI specifically for drug discovery and their system for matching patients to clinical trials, these were areas where, according to that comparison, rivals like, say, Google DeepMind or IBM Watson Health didn't necessarily have the same specific focus or capability shown.
So it's not just general AI, it's AI deeply embedded in the healthcare workflow and data. That sounds like a unique position. Of course, healthcare. That means regulations. How does that play into things?
Oh, hugely. It's a critical factor. They operate under heavy regulation, FDA, IPAA for privacy in the U.S., GDPR in Europe. The fact that they have gotten FDA approvals for their AI tests is a big deal. It shows they can navigate that system.
But it's always changing, right?
Absolutely. Future rule changes are always a potential hurdle. For them and for anyone in this space, it's something they constantly have to manage.
Okay, so regulatory navigation is key. Now, stepping back a bit, what's the bigger picture impact here? How is Tempus AI really changing things like drug discovery or running clinical trials?
Well, their AI models are becoming pretty important tools. By analyzing all that genetic and treatment response data, they give pharma companies insights to help find more promising drug candidates. And there was a statistic in the article that using AI like this could potentially cut clinical trial failure rates by up to 40% and maybe even shorten the time it takes to develop new drugs.
40% reduction in failures. That's massive. Huge implications for getting treatments to patients faster.
Yeah.
Okay, let's talk numbers. Financial performance, investment potential. What did the article say?
So financially, they seem to be doing well. In 2024, revenue hit $693 million. That's up 30% from 2023.
Solid growth.
Yeah. And they went public, IPO, in June 2024. raised about $410.7 million, valued initially at $6.1 billion. And even before that, they'd already raised over $1.3 billion from private investors. So clearly a lot of belief in their potential early on.
Definitely significant backing.
What about now?
Their current valuation and the market they're in.
As of March 2025, the market cap was around $10.97 billion, trading at roughly 10 times their estimated 2025 sales. And the overall AI and healthcare market, it's projected to just explode, potentially over $100 billion by 2028. So the potential market opportunity is huge.
Right. A big growing pie, and they seem well positioned to grab a slice.
Hmm.
So to kind of wrap this up, what are the main takeaways? The key strengths of Tempus AI?
I'd say it's that combination, the cutting-edge sequencing tech, the massive AI-driven database, the strong revenue growth, especially in data services, and those really extensive strategic partnerships across healthcare.
And the potential downsides or risks to watch.
Well, as we discussed, navigating the complex and changing regulatory environment is always a factor. Data privacy and security are absolutely critical when you handle this much sensitive information. And of course, competition is always there, both from other AI players and established healthcare tech companies.
Makes sense. Well, this has been a really great look into Tempus AI. It definitely clarifies what they're doing. Thinking about how AI could personalize healthcare, it leads to some big questions like what advancements in diagnostics or treatment driven by this kind of data analysis seem most exciting? And maybe more importantly, what ethical things do we really need to grapple with as this technology moves so fast? Definitely food for thought. Thanks for joining us for this deep dive.